Hi, thank you for watching Digging to China. I'm Dong Sean. Chinese health authorities have ramped up their efforts to contain a resurgence of coronavirus cases, as the country faces its worst flare-up since the pandemic first exploded there early last year. Cities across the northern provinces of Hebei, Heilongjiang and Jilin have built temporary quarantine facilities, imposed lockdown measures on millions of residents, and rolled out rounds of citywide testing. Armies of volunteers clad in protective gear have fanned out across the affected areas, disinfecting empty streets and shops, according to state media reports. Last week, Beijing city's health officials said they had discovered the more contagious UK variant of the virus in the samples of 2 patients who tested positive for COVID-19 on Sunday. Since the current wave of cases emerged in mid-December, health authorities have found around 1,500 symptomatic cases of COVID-19, the majority of which were local infections. China tallies both symptomatic and asymptomatic cases, but includes only the former in its official count. On January 20, China's National Health Commission reported 103 new symptomatic COVID-19 patients for the previous day, marking the 8th consecutive day of infections in the triple digits. Of the 88 locally transmitted infections, more than half were detected in Jilin and Heilongjiang. The capital city of Beijing and Hebei, the province that surrounds it, were responsible for 26 cases. For months, China seemed to have brought the virus largely under control, turning to a playbook of rapid response containment measures to quickly stamp out any possibility of widespread infection. This time, however, the cases have spread quickly in several places at once, likely helped by undetected asymptomatic carriers and the propensity for people to crowd indoors during the winter, Chinese health experts say. In Wanhui County in far northeastern Heilongjiang province, an outbreak detected on January 9 with a single asymptomatic infection has since mushroomed into 243 asymptomatic and 145 symptomatic cases, provincial health authorities said. As new coronavirus variants sweep across the world, scientists are racing to understand how dangerous they could be. Many of the cases have been linked to a single traveling salesman who is thought to have spread the virus to 119 people as he conducted health-related marketing activities in Jilin and Heilongjiang provinces, according to Jilin Health Commission. The salesman, identified by authorities by only his surname Lin, was diagnosed as an asymptomatic case on January 12 after contact tracers pinpointed him as the passenger who shared a train compartment a week earlier with a couple from Wanhui who had recently tested positive. Mr. Lin took 4 train rides, 3 bus rides, and 1 subway ride while promoting a linseed oil remedy in health seminars, whose attendees are often lured in with gifts such as eggs and rice, according to Jilin Health Commission. Zhao Qinglong, a Jilin health official, told the state-run Xinhua news agency that Mr. Lin was in an early phase of the infection and thus shared large amounts of the virus. The viral spread was exacerbated by the fact that his lectures took place in confined spaces with a predominantly elderly audience, many of whom didn't wear masks. More of the current surge of cases have appeared in China's countryside than in previous outbreaks, posing a challenge to the country's big city playbook. Public awareness of the disease is weaker in rural areas, and some farmers are reluctant to get tested. 2 weeks ago, more than 20,000 villagers from a high-risk district on the edge of Shijiazhuang, the provincial capital of Hebei, were moved into quarantine accommodations, repurposed hotels and dormitories to prevent transmission within households, Chinese officials said. North of the city, Meanwhile, authorities rushed to build last Wednesday a quarantine center with more than 3,000 rooms for isolating close contacts of coronavirus patients, a scene reminiscent of efforts during the early months of 2020, when 2 large field hospitals were built in a matter of days in Wuhan. Temporary makeshift hospitals and quarantine centers, sometimes converted from hotels and dormitories, were instrumental in bringing the infection rate down in China by separating suspected and mild cases from the healthy population, thereby preventing further transmission. In addition to erecting the makeshift hospitals, authorities in Shijiazhuang have conducted 2 rounds of citywide testing on its more than 10 million residents. The 2 rounds found a total of 771 infections as of January 19, according to local officials, many of which were still asymptomatic. Beijing, roughly 180 miles northeast of Shijiazhuang, has also been put on alert as 10 new symptomatic cases have been identified since January 17. More than 500,000 people in the southern district of the capital would undergo testing in the coming days, while the residential communities of confirmed cases have been locked down, along with a nearby subway station. Although Beijing residents can still dine out, go to the office, and visit shopping malls, municipal authorities have tightened the regulations around the public gatherings and reduced passenger loads on public transport. Domestic travelers have been prohibited from entering the capital unless it is on official business or for personal emergency reasons. Such travelers can secure the permission of provincial authorities and provide a negative nucleic acid test within 72 hours before boarding a plane or train, according to local media. The stakes for China's efforts to curb further spread are high, as the Lunar New Year approaches on February 12. In the run-up to the week-long holiday, tens of millions of people usually crisscross the country to return to their hometowns and celebrate with their families. China's cabinet said that those who travel for the holiday must stay at home for 14 days once they arrive. Central and local governments, as well as state-owned and private companies, have appealed to Chinese citizens to stay put this year, offering financial incentives, vouchers, and phone bill credit to those who comply. Some residents complained that the out-of-control epidemic in Hebei is related to the government's promotion of the traditional Chinese medicine Lianhua Qingwen. The herbal medicine is highly recommended as an effective drug to prevent, mitigate, and treat COVID-19, and promoted by Zhong Nanshan, one of China's top epidemiologist experts. However, its efficacy is not proven, and medical experts have raised concern. Thank you for watching. Please leave a comment and subscribe to my channel. Just click the subscribe button right here. I'll see you again shortly.